So, hello, thank you for joining us for the first of a three-part series that we are doing on the impact of childhood trauma. That I am pleased to introduce our presenter today. So, Susan Dannon is a licensed independent social worker with Mindspring Health, where she is a course instructor. She teaches, webinars and series like the ones we're doing today to people from all different backgrounds. But Susan has over 25 years of experience in the mental health field. And I know I've loved getting to learn from her as I've worked with her to create the content for today's presentation. Mindspring Health is a name you also might have heard. We did a webinar with another one of their course instructors for our advocacy series, and we've just been so pleased with the partnership between the IFOPA and Mindspring Health for the insight and the education they've brought to our community, and most of all for their willingness to learn about FOP and all of the unique ways that it's impacted our families. So with lots of appreciation and gratitude, Susan, I will hand it over to you.
All right, thank you very much. So, um, as was mentioned, my name is Susan Dannon. I am a licensed independent social worker in Des Moines, Iowa. So our topic today is trauma in children. I actually used to work in a hospital setting, so a lot of what I've incorporated today is also in regards to medical trauma. So we're going to be looking at trauma in children. We'll be looking at how trauma impacts the nervous system. We'll look at diagnosing children as far as having, significant trauma where they may need some professional support, and then also looking at what we can do as caregivers, providers to support kids who are going through traumatic circumstances. So the first thing is kind of to start with defining exactly what is trauma, and what exactly we're going to be looking at with that. So trauma is an experience that triggers an intense physical and emotional stress reaction, exceeding the individual's ability to cope and challenging their reality, causing a perceived loss of control. So what that really is about is that trauma is any time that we experience something that is significant enough that our usual coping mechanisms are not sufficient to deal with it. So when that happens, we become overwhelmed, anxious, scared, because we don't know how to cope with whatever is going on in the moment. And so because of that, it also is then challenging our reality. So we expect things to be a certain way. And then when this traumatic event happens, our expectations are changed because this was something that was unexpected that we didn't know how to cope with or did not have the coping skills to manage the emotional and physical stress response that we were having. So that's what we're going to be looking at in regards to trauma. So the other piece of trauma to look at is that piece about the loss of control. So there are a couple of different aspects to control. There is the perceived control and the actual control. So the extent to which you believe you control the outcome of an event is your perceived control. So if I believe that I have some control over what is happening, usually the event is less traumatic. And then what we found is with that is that's why the perceived control a lot of times is more important than the actual control in reducing stress. So we have the perceived control, which is our personal beliefs about how much control we have in the situation. So even if we don't have a lot of control, if we believe that we do, if we believe that there's something we can do about it, it's going to be less impact on us. So part of the reason the trauma impacts us so much is if we don't feel that we have any control, we might start kind of grasping to gain control and trying to force something to happen, rather than being able to kind of go along with what is happening in the moment and being able to stay present. So we're going to look at the different types of trauma now. So we often refer to type 1 trauma as acute trauma. So acute trauma is typically a single trauma. It's normally kind of an unexpected event. So it's things like accidents, significant illness, natural disasters, and it's typically less interpersonal, which means that the individual is not usually going to personalize the trauma as much as they would with a type 2 trauma. So in type 1 trauma, the things that are happening we know are not like something that is personally against us, or targeting us. So an accident, a natural disaster, we're not going to personalize that as much as if someone is inflicting trauma on us. So the type 2 trauma is more of chronic trauma. So in these cases, it's more repetitive, ongoing events. So it can include things like neglect, violence, and those type of things. And it can also include chronic, invasive, ongoing medical treatment, bullying, and other abuse. So the piece with that intensive ongoing medical trauma, when you think about a child who is going through that and the invasiveness of some of the procedures, that's where they may consider that more personal, that it's something that is being done to them. Um, and so that the other piece of that is the chronic nature of it. The longer that the trauma occurs, the more significant that it's going to be because of the amount of time the trauma is happening to the individual. And then complex trauma describes both the children's exposure to multiple traumatic events, often of an invasive interpersonal nature, and or wide-ranging long-term impact of the exposure. So this is where you have more than one trauma. It is usually one that the child is taking more personally again, and or it can also refer to the fact that the trauma is going to have a long-term effect. Part of that is that when you have a trauma that really doesn't have an endpoint, that's where it can become also a complex trauma as well. So talking specifically about medical trauma, medical trauma is the psychological and physical reactions of a child and or their family. It's about the pain, injury, medical procedures, treatments that may be invasive or frightening. So anything within that aspect of medical trauma. And I like to emphasize the fact that it impacts not just the child, but also their family. And we're going to talk about that a little bit more in the second part of the series when we're talking about secondary traumatic stress and how that can impact as well. So in medical trauma, what we found is that up to 80% of children and their families experience some traumatic stress reactions following a life-threatening illness, injury, or painful medical procedure. So it is really a high percentage, and I don't think that we really talk about medical trauma as much as we should, especially when talking about children. The other thing that we found in the surveys were like 20 to 30% of parents and 15 to 25% of children and their siblings experience persistent reactions due to the medical trauma. So it is something that, people often experience. And so that's part of this training, is also to normalize that experience and how much it really can impact both the child and the child's family. So the thing with medical trauma is that it is a little different than some of the other traumas as far as it can be a single event, but it can also be multiple events, especially if you have a child who is going through multiple medical procedures, um, or that particular illness that the child has long-term effects. So we're looking at, depending on the circumstances, medical trauma can be a type 1 trauma, it can be a type 2 trauma, and it can also be a complex trauma. So we're really looking at the contributing factors of how that trauma is experienced, how frequently it's experienced, and how much of an impact it has on the child and the family's life and their functioning. Other contributing factors are, how the staff treat the child and the child's family during medical procedures. Um, so if you have doctors, nurses who are caring, who are understanding, who are compassionate, that is going to be a much different experience than if you have an experience where doctors and nurses are being judgmental, are not being kind, are not considerate of what the child and the family's needs are. The other thing is if there is some type of medical treatment that is forced without consent. So that kind of goes back to that loss of control. So when you feel like you don't have a choice about a particular medical procedure and that you don't have any control over it, that is also going to make the event more traumatic. And then also the environment that you're in. So, when you think about a child going and seeing like their family doctor, that might be someone that they're more familiar with, they're more comfortable with, as compared to if they go into a hospital or medical setting where there are unfamiliar faces, there's unfamiliar equipment, questions are being asked, instructions are being given all at once. And so all of that can become very overwhelming. So that's kind of the other piece is looking at what is the environment the child is in that moment and what impact will that have. So the way the child interprets trauma has a more significant impact than the objective severity of the medical procedure. So that goes back to what I was talking about with that perceived control. So the more the child interprets this trauma as, something that is out of their control, the more of an impact is going to have. So even a very severe, invasive type of medical treatment, um, if the child gets the right support and understanding of what's happening, it is going to be less traumatic for them than if they perceive this as something that is very much out of their control, that they aren't able to manage, that they don't have any choices about. So the way that medical trauma can really impact is that there is this disruption in daily life, especially when you have a chronic medical condition. So your life a lot of times ends up, coming around whatever the medical trauma is. And it takes over choices that you make, decisions that you are making on a daily basis. Hinder adhering to medical treatments. So if the person interprets the medical treatment as invasive, as interpersonal, as traumatic, then there is more of a likelihood that they're not going to want to follow through with those medical treatments. So the more compassion, the more understanding, the more that we deal with the trauma, the better that the child is going to be willing to follow through with those treatments. And a lot of times, the more willing the family is going to be willing to follow through with medical treatments. And then if you're not following the medical treatments, that is going to obstruct progress. So again, we want to be talking about this medical trauma because we want to have those good outcomes. We want to, progress in a way that is helpful. So looking specifically at FOP as far as medical trauma and the reason that it can be interpreted as traumatic for children and their families is that, FOP is a chronic medical condition. So that in and of itself is a trauma because it is something that is chronic, it is long lasting. Um, it is something that you don't expect. And so working around that is a part of that trauma. Flare ups can also be traumatic. With flare ups, you have moderate to severe pain. And severe pain is often linked to an increased level of anxiety and irritability. The other thing with flare ups is that, you know, they are unpredictable a lot of times. There are times that you may have an idea of what can cause a flare up, but then there are also times that flare ups happen with no particular cause to them. And so again, that's kind of that piece of that loss of control is the not knowing, not re- recognizing or being able to recognize when something is going to happen. The other thing with the pain piece is that there is still pain even during non-flare ups. So again, that's part of that chronic piece of that condition and not being able to always control the pain. And then, of course, fear of medical treatments, because any type of medical treatment may end up causing flare ups. And so then there's this, combination of we know that we need to get treatment for something, and this treatment may do more harm than good. And how do we weigh that out? So making those decisions can also kind of give that sense of that loss of control, of the unknown, not knowing if this is going to be safe or unsafe. Progressive physical limitations. So, when you think of FOP, the progressive nature of it, those increasing physical limitations can have a profound impact on the individual's quality of life. So, the more that movement becomes restricted, the more challenging life becomes, the more adaptations to the living environment, the more dependent the child may become on certain things. All of that can be traumatic because, again, part of those changing adaptations are the fact that they can happen suddenly. So, there is kind of that progressive piece, but then there's also that piece where it can suddenly occur that you're needing more adaptations or that the physical limitations suddenly become much worse and not knowing when that's possibly going to happen. And then there is also a piece of the financial impact. When you have a child with a chronic medical condition, there is, concerns and issues about how is this going to have an impact financially. It may change, career plans. You may have missed days of work. So all of this impacts the individuals and their families. So I wanted to also kind of look at some of the social and psychological aspects of the medical trauma. So, with FOP, one of the social and psychological pieces of that trauma is the rarity that creates isolation. There are obviously not a lot of individuals who are diagnosed with FOP, so that can cause the child and the family to feel isolated because they have a difficult time finding others who understand the unique challenges of living with FOP. Um, because of the rarity of it, I think one of the other challenges is that, especially at first, there may be a lot of issues with misdiagnosis and misinformation about FOP. So I know that a lot of people have, gotten diagnoses that were incorrect that ended up worsening the condition because it was misdiagnosed. Um, Also, because a lot of times medical professionals have not dealt with FOP before, they may give a much graver um, explanation of what's going to happen that is even more frightening, more overwhelming than what it needs to be. Um, Also, because of the nature of FOP, there have been issues with accusations of abuse or neglect, especially if the medical facility is not aware of how FOP impacts the child, impacts their physical self. The unpredictability, we kind of mentioned this earlier, and as you're living with that unpredictability on multiple fronts, that takes a toll on you psychologically. And then there is that psychological piece of realizing that at this time, it's irreversible progression. There is no way to stop it. And so knowing that and knowing that there's going to have to constantly be these adaptations, that chronicity of the event is also the traumatic piece for the FOP. And then we also wanted to touch on the fact that there is also, that piece of family trauma regarding siblings. So for siblings, their future is also uncertain. So knowing that they have a brother or a sister with FOP, they may be concerned about, the uncertainty of their sibling, the uncertainty of the family, what is going to happen. And so that can also cause a traumatic reaction. A lot of times, other children in the family, if they don't understand the disease, will become afraid that they can contract the disease from their sibling. So that can be a cause of anxiety and concern if they don't fully understand the nature of the disease. And I think that that can especially happen in the beginning when there's a difficulty in finding the diagnosis. So the sibling knows that there is something wrong, the family knows there's something wrong, and we don't have a name for it yet. And so that creates a lot of fear of what exactly is going on. Is this something that I can catch? So that can be another aspect of that fear of, can I get this disease? Of course, there's that fear that something horrible is going to happen to their sibling, fear that the sibling is going to die. Um, so again, not, kids have a hard time wrapping their minds around chronic disease and helping them understand that and what the progression is going to look like. Because the disease is oftentimes unpredictable, that is going to be traumatic for the siblings as well, because you don't always know what is going to happen. And then there is this sense of helplessness, which is part of that secondary traumatic stress that I was just talking about. So that sense of helplessness is whenever we see someone that we love who is in pain, who is struggling with something, and we want to help them, and there's no way to help them. That can cause a traumatic reaction as well for the child and the child's family. And siblings definitely have that reaction as well. So, like I said, the second part of the series is going to talk about, you know, how we help children and go through kind of the stages of trauma healing. And that third webinar is going to be about this secondary traumatic stress and going into that more in detail for the caregivers and for siblings. So we'll talk about now trauma and how it impacts the nervous system. So this is something that really has been more looked at probably in the past 10 to 15 years is we have gained greater and greater understanding about how trauma impacts the nervous system, um, and what to kind of look for in traumatic reactions, both mentally and physically. So, to talk about the impact of trauma on the nervous system, we need to have kind of a basic understanding of what the nervous system is. So, we have what is referred to as our automatic nervous system, and often that is shortened as ANS. So, the job of the ANS is to regulate our body. It is done unconsciously. So, our nervous system picks up cues from our environment and then uses those cues to streamline and regulate our bodily actions without us having to think about it. Within that automatic nervous system, we have the parasympathetic and the sympathetic nervous systems. So, the parasympathetic nervous system is the system when we are calm, when we are relaxed. And then the nervous system that kicks in when we're under stress is that sympathetic nervous system. So that is our stress nervous system. So if we think about the automatic nervous system as kind of this thermostat of the body, it will turn up the heat, when it's too cold, it turns on the air conditioning when it's too hot. There are pauses in between to reset. So the ANS is really acting as a regulator balancing between the calm system and the stress system. So we're going to look at the calm system a little bit as far as understanding what the calm nervous system does. So during that calm nervous system, we're going through what is referred to as rest and digest. So our calm nervous system is when we feel safe, when we feel relaxed. And when we feel safe and we feel relaxed, the parasympathetic nervous system will reactivate systems that were shut down during stress. And we're going to talk about that in just a moment as far as what systems get shut down during stress, and then how the calm nervous system turns those systems back on to rest and digest. So, one of the main things that it does is that it starts to slow down our heart rate, it lowers our blood pressure, it digests our food, it nourishes our body. So it is taking care of a lot of times that healing process. And with that, your breathing becomes more relaxed. You don't have to work as hard to breathe. We're finding that there are actually 12 cranial brain nerves that connect, that let us know when the rest and digest needs to be activated as compared to when the stress system needs to be activated. And we're going to be talking about this a little bit more with the vagus nerve. So we know that the vagus nerve contains about 75% of the PNS, which is that parasympathetic nervous system, that calm nervous system. So 75% of the PNS comes from this vagus nerve. And that vagus nerve is the nerve that helps us know when something is wrong with our system. And then it also is the one that calms our system. So just some things about, brain basics. We have our brain stem, which is our involuntary functions. So the brain stem is the basics of our fight or flight response. It is the one that keeps us alive. It is those things that we do without having to think about them, like breathing or heart beating. And then the limbic system gets a little bit more into that fight or flight. So that is the emotional center of the brain. So when the brain stem picks up on that there's something in the environment that's wrong, that goes to the limbic system, which interprets that as a threat. So we go into what is referred to as fight, flight, or freeze. So with that, fight is about there's something coming at me and I either need to fight it off, I need to flee from it, or I need to freeze. So freezing is usually kind of like disassociating and hoping that whatever is coming after you will become disinterested and walk away. So the difficulty with this, with medical trauma, is that when the nervous system gets set into that stress response, there's really not something for it to fight or to run from. And so you have this constant stress reaction in the body that starts to impact the physical and the mental body. Um, and then when we talk about the prefrontal cortex is where we have our logic and our reasoning. So it's where we can stop, we can think, we can logically go through, we can consider whether this is a threat or not a threat, and we can problem solve options. So often that's one of the things that I am working with children with chronic trauma or anxiety is how do we tap into that thinking brain to calm that feeling brain so that we can make logical choices even when we're in the midst of a traumatic situation or in the midst of anxiety. So this is really kind of that breakdown of the parasympathetic and the sympathetic nervous system and what happens with those systems. So you have there on the parasympathetic nervous side, that is the rest and digest. Um, so, everything is online, all of the systems are online and working. In the sympathetic nervous system, when that turns on, what happens is there are certain parts of our body that shut down in order to take that energy and move it towards the parts of the body that are needed for fight or flight. So it shuts down certain aspects and then takes that energy and increases the reaction in other parts of the system. So the majority of the aspects that get shut down in the sympathetic nervous system is our digestive system. So as we look at this and go through it, one of the things that changes is the eyes dilate. So the pupils start to get bigger because the eyes are trying to take in everything that is around them that might be a threat. And then the salivary glands shut down because they are part of the nervous system. So, and digestive system that gets shut down. The reason for this is if you think about if something is coming after you as a threat, taking time to digest food and those type of things is not needed. So that is where the body shuts down those aspects so that it can reportion those energies to where it's needed. So this is where often individuals with chronic stress or with um, anxiety will complain about having a dry mouth because the salivary glands have been shut down. The next part is the heart. So that is one of the systems that gets elevated. So the heart starts beating faster to get that blood and oxygen to the parts of the body that are needing it to get ready for fight or flight. Lungs, they dilate. So we're talking about the fact that our breathing gets faster, it gets more intense. The stomach, again, part of the digestive system is inhibited. So this is where individuals with chronic stress, anxiety will talk about having an upset stomach, having difficulty digesting food, um, will sometimes be more or less hungry than usual because that system is not working the way that it should be. What is happening in the liver is that it is stimulating glucose. So glucose is the sugar that our body produces. So one of the things that can happen when you have chronic stress or trauma is that your glucose levels can end up being unstable. So we have found that individuals who have chronic stress are at higher risk of things like type 2 diabetes. So that is one of the reasons that we want to try to get that stress under control as much as we can, because it does impact all of these body systems. The kidneys will start stimulating chemicals that are going to be released to help us with that fight or flight. The chemicals that are being released give us energy. So again, for that fight or flight. Intestines and the bladder are the last aspects, and those are also part of the digestive system are going to be shut down. So again, this is why children with anxiety, chronic stress, trauma will often have more toileting accidents than the general population. Because again, the body is saying these are systems that aren't needed at this time if we are truly in danger. So the more that we can learn to move out of the sympathetic and back into the parasympathetic nervous system is going to not just help emotionally, it's also going to help physically. And then you'll notice that that vagus nerve runs the length of that nervous system and impacts all of those different systems. So what the vagus nervous system is about is it really is our social nervous system. So it picks up on cues in the environment that tells us whether or not the environment is safe. So it is the part of the nervous system that reads faces, that notices the energy in the room. It also is connected to our tongue and our facial features. So, it's not only just about reading other people's facial features, it's about our facial features and how we show other people that we are under stress. It is connected to our tongue so that we can speak and we can ask for help. It is connected to our heart. So when we talk about our heart hurting or having heartbreak, that is our vagus nervous system. It also impacts our lungs. So that is a part of that rapid breathing. It impacts and it's connected to our stomach. So when we talk about having a gut feeling or talk about butterflies in our stomach or feeling sick to our stomach because we're so anxious, that's a part of the vagus nervous system as well. So it also has a large impact on this sympathetic and parasympathetic nervous system. So the other piece of this that is important to understand is somatic experiences. So because we're not just impacted emotionally with trauma, we're also impacted physically. Negative body memories can become trapped in our body. And so our body oftentimes will feel the trauma even when the trauma is no longer present. So some examples of this are like a pseudo pregnancy. So I have worked with women who have had a pregnancy loss that was traumatic for them. And as they are working through that trauma, they will start to have symptoms of being pregnant, even though they're not actually physically pregnant. There are also what are referred to as non-epileptic seizures. So if you've had seizure activity before, sometimes your brain will interpret that as a threat, And so then whenever the body feels threatened, it will go into a non-epileptic seizure. So it will look like you are actually having a seizure and there's no actual physical reaction of the seizure. It is a somatic experience because your body is interpreting any type of stress as a seizure. We also, we'll hear about people talking about a phantom limb. So if someone has had like a um, limb that has had to be, surgically removed, they may talk about still being able to feel that, that hand or that foot or that leg, even though it's not physically present anymore. So those are what somatic experiences are about. So there are actually people that specialize in somatic experiences therapy. So in somatic experiences with the therapy, they will guide people through somatic experiences and tasks to help them release stored emotions that are in the body, um, so that they don't feel so shut down, and those various levels within the nervous system can start reacting in a healthier way again. So talking about the impact of trauma. So there are things that, factor into how traumatic an event is going to be. The first piece is how chronic is the trauma. So how long lasting is it? How invasive is it over a long period of time? And part of that chronic piece about the trauma is that can be traumatic is when you have a trauma that doesn't have an end. So with FOP, that can be part of the difficulty with the chronic piece is that there's not really an end point to the trauma. A lot of people experienced that during the pandemic. We didn't know when it was going to end, and that was part of the trauma, is not knowing when the end is in sight, not knowing if there is going to be an end. The other impact is what resources the child and the family have. So the more resources that you have, the more education that you have about trauma, the less that the trauma is going to impact the child and the family. The ability to provide a sense of safety. So one of the things that we can do for kids is to say, yes, this is difficult. Yes, this is something that we didn't expect. And we can figure this out. We have people who can help us. So creating that sense of safety becomes important. It's also a lot of times about us as caregivers managing our own stress and anxiety about what is happening so that the child is seeing us be as calm and as centered as we can be because their social nervous system is looking toward us and interpreting our stress. So the more that we are able to, have that calm presence with the child, the more that is going to help them. Age and developmental level. So the younger a child is, we have found the more traumatic an event is going to be. So if you think about that, is when a child is at a very young age, this is all they know. And so that trauma becomes more imprinted. So that is also why we want to really get services to kids who have had trauma at a very young age. In the past, I've had people talk about, well, this child is too young for therapy. There's not an age that's too young for therapy. There are even, people that specialize in early childhood therapy that's like infancy to the age of 2 years old. We can start play therapy, so at the age of around 3. So I see as children as young as 3 years old for therapy. So the younger the child is, the more impact it has, but also if we can get to those kids at a young age and we can start giving them the tools to cope with the trauma, the better off that they're going to be, which kind of leads to that piece about family response. So the more responsive the family is to the trauma, the more supportive they are, the less the impact is going to be there. So what are kind of the symptoms that we should be concerned about that are telling us that the child is interpreting what is going on as a trauma? The first thing is that they often will have unwanted thoughts and images. So they are reliving that trauma in their mind. They're frequently thinking about it. Images or flashbacks will happen where it feels like the trauma is happening all over again. It may be images of, something that happened to them in the medical facility. It may be a flare up. And so if they're talking about feeling like they're having these thoughts or images that they can't control, we often will refer to them as intrusive thoughts. So they come even though we don't want them to, and they feel like we can't control them. And so that becomes traumatic in and of itself. So these unwanted thoughts and images. Something interesting to know about that is there has been some very recent research that has come out just like in this past year about these unwanted thoughts and images. So we've often talked about the fact that when people are having these thoughts, images, flashbacks, it feels as if the trauma is happening all over again. Initially, we thought that was because the amygdala, it's so strong that it was kind of interpreting it as happening in the current moment. What the research has found is that traumatic memories are actually not stored in the hippocampus, which is where trauma is usually stored as far as things that have happened in our past. And the hippocampus and the amygdala often work together as far as interpreting something that, okay, this is something that's happened in the past that was traumatic. So the amygdala kicks in and says, okay, this is something that has happened before, and we need to get ready for fight or flight. So what we found in the research is that the traumatic memories are not always stored in the hippocampus as a past memory. They're actually being stored in our cortex, in our thinking brain. And so our brain is actually interpreting that the trauma is happening right now because it's a part of the brain that considers what is happening in the present moment. And that is why these traumatic experiences and memories feel so real, is because the brain is actually interpreting it as something that is happening right now. And so when a child talks about that and talks about the fact that it feels like it's happening all over again, that is because that's how their brain is interpreting it. The good news about that is because it is in the thinking part of the brain, that's why cognitive behavioral therapy works so well in helping kids and adults learn to manage their thoughts in traumatic situations and anxiety producing situations, because being able to use that thinking brain is going to help calm the emotional brain. Other things that you'll see are a lot of negative feelings. So they're going to struggle with being overwhelmed easily, becoming excessively anxious. Just talking about having a medical procedure is going to bring up a extreme amount of anxiety, worry, and they will talk about often having a hard time getting that worry out of their mind. And that is just kind of cycling over and over again. There will also be an avoidance of reminders. So they may avoid or become agitated or distressed, trying to avoid people, places, or things that remind them of the trauma. So this is where, kids with medical trauma can become very anxious when they have to go and see the doctor or have to go to the hospital or have to go into an ambulance, because those things normally have been a traumatic event for them, and they're wanting to avoid those things out of fear. And all of that is that arousal and reactivity. So they feel that danger and that threat is in this present moment. And because they are having that stress reaction, that, sympathetic nervous system, that stress system is going to turn on. And that's where you're going to have kids complaining about those stomach aches, headaches, dry mouth, body aches, changes in their appetite, difficulty sleeping. So if you're seeing any of those, arousal or reactivity symptoms excessively, then that's also a cause for concern as far as the child needing assistance in dealing with that traumatic event. So, what are some of the things that we can do? Well, while we have found that, trauma does significantly impact our brain, we have also found that the brain can grow with the right stimulation. So when we think about trauma and having, that sympathetic nervous system kick on over and over and over and over again, that becomes a pattern in the brain. And that pattern starts to become hardwired. And we can change that, especially the younger the child is, to create new patterns. So while it is significantly impacting the brain with the trauma, we're also finding that there is this brain plasticity where there can be changes in the brain with the right type of stimulation. So the things that we have found that help stimulate the brain in a positive way to cope with the trauma are having positive relationships, and especially nurturing and gentle touch. Novelty. So doing things that are new, learning things that are new, stretching our brain, that is going to help create new processes. For children, that can also be play. So playing with things, trying out things that are new, all of that novelty. Physical exercise, especially any type of aerobic exercise that gets the heart rate higher. Mindfulness. So mindfulness is about focused attention. So being able to focus on something for a particular period of time. Having healthy nutrition. So, having foods that are medicine for our body, having a good amount of sleep, and then repetition and sensory motor stimulation. So kids who have gone through trauma will often replay their trauma through their play, and that play is a part of their trauma play of repeating those things. Some other things that we found that are protective factors is that if the child has a nurturing environment, they have positive connections, if there is knowledge of parenting and of child and youth development, so the more that you know, the more that you're able to respond to your child, how resilient you are as a parent. So we just talked about that with, your responses and them reading that social nervous system, having positive social connections. So having that group of people that support them. If you have concrete supports for the parents, things that you need to be able to support your child. And then the child having social and emotional competence. So they're able to know how to take care of their nervous system. So we want to actively listen to the child and the impact that it has on the child so that they know they're heard and they're understood. We want to raise awareness and understanding of FOP so that children are not traumatized by the medical system. We want to reach out for support from family, friends. The FOP community also plays a vital role in coping with the emotional challenges of the disease as well. So support groups, counseling, all the things that IFOPA is doing, those are things that are going to be protective factors as well. So you'll also be getting these resources. Some of these are the IFOPA resources. So, again, that's utilizing that to help with the trauma. You'll also be getting some recommended readings. So these are some of the things that I used within the presentation today. And then some of them are added things that may be helpful as you are working with your child and dealing with some of that trauma. And then we have the contact information for MindSpring. So if you want to get in touch with us, and then again, we want to thank IFOPA and MindSpring for hosting this webinar today. And I'll go ahead and stop the share and let IFOPA take over to kind of wrap us up.
Thank you, Susan. That was a very thorough, really just introduction. This for part one of the series is sort of setting the foundation to help people identify a little bit more of that trauma. And I think nothing that you shared on your FOP related slides was probably new to any of our families. I'm sure they're all aware of the unpredictability and the chronic nature and all of those things. But I think hearing someone with your experience and your level of expertise really validate that these can be traumatic experiences is very impactful. So I hope that all of our families, took that not as a fearful way of saying like, here's this other thing now that you may need to deal with or add to your list, but to say that this is one other way that the IFOPA is here to help support you by providing education. And I know in the next two parts of our series, we're going to dive deeper into some of the resources to move forward into the stages of healing and in supporting the caregivers and family networks. So thank you so much for doing such an excellent job of giving us this introduction and starting us off in this conversation. And I didn't have any questions. I feel like you covered everything. I know our attendees were pretty quiet as well. And so if anyone does have a question that they kind of come up with between now and next week, please feel free to email that to me and I'm happy to pass it along to Susan so we can have it either incorporated or have an answer prepared and ready for you in our series continuation that happens next week. So on Friday, May 10th and Saturday, May 11th, we will be continuing part 2 and part 3 of these series. It is at the same time. And I think you all have registered for the 3-part series, so you'll be getting your reminder emails. And for anyone who joined late, I know we had some people join through partway through the series. This recording will be available on our YouTube channel early next week. So you can go back and watch it if you want to have that sort of already in your brain before we continue into the next parts. But I want to thank Susan again and MindSpring Health for partnering with us to provide this. And thank you to all of our attendees for joining us. I hope you have a great rest of your day.
Thank you.